Mr. Hall?
Thank you, Mr. Chairman. I have multiple concerns with America's Affordable Health Choices Act of 2009, but I'll try to be brief and narrow my statement down to just a few points. I don't know many points because, like everyone in this room, or almost everyone in this room, I've not read the 1,000 or so pages, but I have some idea, and I have some things that I'm concerned with, and I'm concerned that I'm afraid this bill could end up limiting access and decreasing quality, especially for our children. And when I say especially for children, I say first especially for poor children, because they're hit first and they're hit hardest. But children are also hit. They're next on my table of those that I'm more concerned about. Medicaid insures more than 1 in 3 children of Texas, making it the single largest children's health insurance program and the single largest payer for children's hospitals. Children's hospitals are major providers of children insured by Medicaid. In FY 2007, children insured by Medicaid accounted for 50% of inpatient care, 45% of all outpatient visits, and 58% of all emergency room visits at freestanding children's hospitals. Medicaid is often the building block for health care efforts, and we must ensure that this program remains strong to ensure that coverage translates into access. The public plan proposes to pay at least Medicare rates to ensure access. However, Medicaid pays on an average of 20 to 30% less than Medicare. When examining Medicaid and Medicare reimbursement rates on average children's hospitals, Medicaid payments are only approximately 80% of what Medicare would pay for similar services. For physicians, Medicaid only pays 72% of what Medicare would pay for the same service. All Medicaid providers should be reimbursed at levels equal to Medicare. I have just one last minute. I want to say that the Democratic bill, and I'll close with a statement from the U.S. Chamber of Commerce, which represents thousands of U.S. employers that provide tens of millions of jobs, and they say in one brief paragraph, the Democrats' bill fails to pass our simple litmus test. This legislation will not address the nation's health cost explosion, will steeply take taxes in an already precarious economic situation, will fail to lead to more affordable, accessible, quality health coverage, and will lead us toward government-run health care. In short, it will make a bad situation worse at great cost to the nation in jobs, taxes, and freedom. Mr. Chairman, we should not be raising taxes on our small businesses, especially at a time when so many hardworking Americans are struggling. After all of the bailouts, with cap and trade looming over our heads, and now this massive health bill in front of us, I am, for the first time in my history, worried about the future of this country. That's signed by the chairman of the U.S. Chamber of Commerce. I thank you, and I yield back whatever time I have.
Gentleman's time has expired.